Hi, my name is David Scrimgeour. I'm an acupuncturist and practitioner of Chinese medicine. And this little presentation is designed to tell you about a formula that I created called Cold Nip. There's several things about Cold Nip that are very unique. It's based on classical Chinese medicine, and it's based on 3 classical formulas from Chinese medicine, plus a few very specific antiviral herbs. The 3 formulas that we used in this formula are called Guguntang, Inqiaosan, and Archantang. Now, Guguntang is the Chinese for a formula called Pueraria. And basically, Pueraria is a very, very old formula that's been used to treat the onset of viral infections. And what it does is basically it treats the early stages of a cold, which are sometimes can be things like chills, fever, muscle aches, and kind of a general malaise. This formula, what it really does is it warms up the system a little bit, what we call the Wei Qi, or the defensive system in Chinese, which is really the surface. There's a whole understanding in Chinese medicine that if you're being attacked by a pathogen, typically what we call a wind cold or a wind heat pathogen, it comes in sometimes through the back of the neck, but certainly through the skin and sometimes through the nose. So the whole idea of this is to really get your defenses up in terms of that by warming the system a little bit and creating that defensive system to stop the invasion of this pathogen. The second formula that we use is Inqiaosan. It's a very well-known formula in Chinese medicine for treating the common cold. And it has some really great herbs in it, one being Lonicera flower and the other being Forsythia fruit. These 2 herbs have been shown over the many, many years to have antiviral and to some extent antibacterial properties. We use this formula really for more of the heat type symptoms, which are things like sore throat. It can certainly be things like fever, and it's really what we would call more of the wind heat type things, which pretty much everything that starts out even as wind cold in Chinese medicine as a cold will turn into wind heat. So the point of this is that pretty much all of those things, no matter how it starts, will very quickly turn into these types of symptoms. So we want to have the herbs in there that can really help defend against that and to fight that off. The third formula that we use in the combination here is the Archantang, which is called Citrus and Pinellia. Citrus and Pinellia, basically what they do is they help digestion, but they also break down mucus. They break down the body's, in a sense, ability to make mucus, which therefore creates an environment which does not lend itself to the basically proliferation of a virus, but really kind of stops that. It doesn't give it that kind of environment because the mucus has been really broken down. So what we've done is combined these 3 formulas, which have had a really wonderful effect in terms of stopping a cold in its tracks. And we added 2 very well-researched herbs, one called Andrographis. There's a lot of research done on this recently, which shows that it absolutely stops a common cold, absolutely is effective against many of the common cold viruses. And another herb is very well known in Chinese medicine called Isatis. We use both the root and the leaf because we found that it actually works much better in that combination. And this combination was also used in the SARS virus in China, which was quite an epidemic, and this is really what it was, not Western medicine, it was Chinese medicine that really stopped that. So what we've done with this formula, we've put it into a tincture form. It's a 12-to-1 combination. We get it tested in an independent lab once it comes into the United States and China. It's extremely safe. It always passes with flying colors. And I think the most important thing about this formula is how well it has worked for my patients over the last 21 years. I've given it to hundreds of people extremely successfully. I would say it's about 80% successful. And they come back and get it. They get it for their family. They get it for their friends because it's something that really, really works. I'm very happy to be able to provide this formula, to put it out there after many, many years, again, of using it clinically with great success for my family, for myself, and for all my patients. I'm sure that you will find the same great results from it, and that's pretty much it. Thank you.